I was wondering if Buteyko works with just reducing breathing volume or also breathing frequency, and how long it will take for a person to see results.
The Buteyko method helps us to reduce our air intake.
Mm-hmm.
So most people take in much more than 5 or 6 liters of air per minute, which is a medical norm for someone who is very healthy. So the Buteyko method helps us to start reducing the number of liters we take per minute to come as close to the norm.
Okay.
Within the Buteyko method, it's not recommended to work with the frequency of breathing. We do work with it, but indirectly. For example, we practice relaxation, and as a result of it, your breathing of a person, once breathing becomes slower naturally, and also the air consumption decreases. But there are many breathing techniques, like one was mentioned by Casey, when people are advised to, for example, to count like, up to 4 while they're inhaling and count 6, when they're exhaling. So to limit the inhalation and exhalation by a certain number of seconds. This is...
I've taught that too.
Pardon?
I said, I've been taught it by my physician to breathe like that. And that really gave me breathing difficulties, to be very honest.
Right, exactly.
Good.
Yeah, so this is definitely not recommended within this method because everything is individual. So if someone, like a general advice, for example, to inhale within 4 seconds and to exhale within 7 seconds, for someone could not produce good results because their breathing can do much more. And for someone, it could significantly worsen their breathing because it's too much for this person. And in general, breathing is an automatic function and it should stay this way. So any work with breathing should be very gentle, very careful, and very individual. And unfortunately, often people just don't acknowledge this and practice what I call violence against their bodies, violence against their breathing, and violence or aggressive methods. Violence cannot produce balance, cannot produce peace, and therefore it cannot produce health. Yeah. Fred,
that's very clear.
Thank you.
And I think you make a good assumption or assessment when you say in the medical field there are a lot of things you don't agree with. It may be surprising, but I agree with you wholeheartedly. In my training, in a traditional way, there are plenty of things just in general that we're instructed to teach our respiratory or asthmatic patients certain breathing techniques that we're told to instruct our clients in the hospital. Well, once having this information and getting trained with the Buteyko method and really understanding what is really occurring on a physiological level or cellular level, and using this information to improve that, it greatly contradicted a lot of the principles that I was taught as a therapist even to this day. And I found that when I was able to apply the principles of Buteyko with my patients, I got improved, better results. Like, for example, there was an asthmatic woman, just in general, who was in the ICU. And it was the beginning of my shift, and she was very, very bad. tight, wheezing. That's why she was in the ICU. And so I was just able to share with her some just basic principles that I learned from Buteyko. Relaxed breathing, not talking on her cell phone like she was doing. I mean, answering this phones and she's having breathing problems. Focus more on nasal breathing. And those simple principles, because in the hospital, I can't get into the details because it totally is counterintuitive to, you know, their practice. But some of the basic principles I'm able to share and instruct my clients in the hospital. And let me tell you, by the end of my shift, this woman who was, I thought, you know, was going to be there for a couple of days, and normally they are in the ICU when they're that bad. By the end of my shift, she was being discharged to the regular floor. And I really believe it's because some of the principles that I shared with her to make some slight adjustments at the very beginning of the shift. And so this is where I'm constantly even, you know, correcting nurses and saying, no, it's not really about taking a deep breath. Because what happens is there's a lot of misinformation and lack of information when it comes to health and especially breathing, because no one talks about it. You know, no one talks about even the importance of what is healthy breathing, let alone be able to properly instruct someone. So what happens is it's really about monkey see, monkey do. What people have heard over the years, that's what they assume that it's correct and helpful. And that's why you will constantly have doctors, nurses, various peoples in various professions in the field that you would assume, oh, they know what they're talking about. They really don't. And that's why we have a health crisis on our hands in our country, and why even though when they're going to these institutions, they're not coming out well. They may, because of, you know, certain things that they're doing, may help to take off the edge, but they're certainly not being discharged home and gaining a level of health opposed to just symptom care. It's really not health care, it's just symptom care. And with this method, that's what we try to do to address that aspect of providing health, not just symptom care or, you know, helping you with this symptom or that symptom, but really looking at you from a holistic perspective and approaching it that way. And that's why people are getting results.